on an occasion filled with centuries-old traditions, critics say the government failed to address Ontario's biggest present-day crisis.
Your government is actively engaging with health system partners to identify urgent, actionable solutions.
This throne speech, delivered on behalf of Premier Doug Ford, largely repeating the themes that just recently won his Progressive Conservatives a majority.
It's the lack of urgency in the policy points that is the most surprising.
Since the election, Ontario hospitals have suffered worsening staff shortages, with some emergency departments temporarily closing and others forcing patients to face harrowing waits. In Chantel McNeil's case, 19 hours while in excruciating back pain.
It was actually an 8.7 centimeter cancer.
Her agony reflects a healthcare system that some staff say is on the brink of collapse, and critics say is overlooked by Ford.
The government had a chance to table a new budget to deal with these crises, and Doug Ford chose not to.
The PC government is again tabling its same spring budget with few updates. This despite repeated demands from healthcare unions for measures such as improving mental health support for staff, more quickly integrating foreign-trained workers, and repealing an annual 1% cap on pay hikes.
We're not here to bash anyone. We're saying, let's work together.
The finance minister insists Ontario is doing what it can within its means.
Responsible fiscal management is needed now more than ever.
But Aram Chagala questions the government's approach.
They need to come into the hospital and see what's actually going on.
She's living the hospital crisis as a registered nurse working in the gravest emergencies.
This could cost lives. It's very concerning and very, very scary.
So, Thomas, given everything you've just said, what does the government say it's going to do to address the hospital crisis?
Well, the Ontario government here at Queen's Park has pointed to numbers repeatedly, and they did again today. They say that they've added more than 3,000 additional hospital beds. They've hired thousands more personal support workers and nurses, but those who've been on the job say that's hardly enough. Now, there was an acknowledgement in today's throne speech that more can be done to address the crisis in healthcare, but the government is not saying what it might do or when. Adrienne.
All right, Thomas Dagla in Toronto, thank you.